Good afternoon, and thank you for joining. On behalf of the Cornet Mid-Atlantic Chapter Board and Executive Committee, we appreciate you dialing in for today's webinar, which is sure to be a dynamic and robust discussion with really an all-star panel that we have joining us today. As always, thank you to our chapter sponsors. We greatly appreciate the continued support, without which programs like this would not be possible. And thank you to all the volunteers in the chapter that put this content and programs together in these certainly unprecedented times. We have a couple of these events under our belts now, and the chapter's committed to keeping these things coming forward, whatever venues that we can make them happen. I'm John Matron. I'm Director of Real Estate and Facilities at Geico. Again, thank you for joining and welcome. For today's call, we are going to be talking about the preparations that corporations have been making to re-enter the workplace, and obviously a topic that's on everybody's mind. Following today's call, we're going to have a happy hour that we hope you can join us for, to just recap on takeaways and the discussion that we've had during today's call. That's going to be starting at 4:30. Some other events upcoming in our forecast here. We're going to continue the Cornet Cafe series. This Friday at 9:30, Katie Redmond with JLL is going to be interviewing Jeff Lamb at Very. And please keep an eye out for those Cornet Cafe series as they continue to be published on Friday mornings. On Wednesday of next week, May 13th, the Young Leaders team is hosting a mentor-mentee program, Career Advice and Cocktails. So that's another one to please keep an eye out for and register as your time permits. For today's webinar, we're going to have all participants muted as we work through the conversation, but you are welcome to submit questions. So there's a questions panel in the dashboard, so please feel free to post something. We'll be keeping an eye out for those questions as we work through the discussions, and we'll have some time for Q&A at the end of the conversation. So with all that said, let's get started. So again, we're discussing the preparing for the return to work and what corporate real estate is doing to get their buildings reoccupied. And today we have a panel of leaders, certainly within their companies and industry-wide, and they're here to discuss what their companies respectively are doing to get their workforce back into their buildings and get their buildings ready for re-entry. We'll learn a lot about best practices and get a wide range of well-rounded perspective that I'm sure will be all great takeaways to take back to our respective shops. We are going to do an entrance poll as we get started. So there's the polling panel in the GoTo webinar. So the question to start is, when will you be returning to work? And you'll see a drop down in there that has the before mid-June 2020, between July to September 2020, October to December 2020, or January 2021, or maybe that's the later of any of those dates. And for all intents and purposes, that probably has to be a no sooner than start date, as obviously things are changing by the day here. And we'll pick that question back up as we get through. So getting into it, again, I'm very honored to be sitting here with a great group of panelists, experts in the industry, and I'm so honored, in fact, to be here that I actually shaved and took a shower this morning. So thank you, gentlemen, for joining us. So we have Drew Mucci, co-president at HIT, David Ritchie, executive vice president, JBG Smith, and my friend Peter Van Emberg, Global Director at CBRE. Gentlemen, thank you again for joining us. Really appreciate you carving out the time to talk to us here today.
Thanks for having us.
Absolutely. Peter, I'd like to start with you. CBRE, you've got the global portfolio, offices all over the country. and you're in a little bit of a unique position too, because you guys are also an advisor and you're out in front on the research industry wide, and advising your clients. So you're probably getting a lot of information from a lot of different sources. So what's been your plan at CBRE to integrate all that information and to come up with the roadmap to get your offices repopulated?
Yeah, thanks, John. And I think I have the pleasure of running a corporate real estate organization globally for a real estate company. So I'm getting a lot of information, a lot of helpful ideas from our market leading, professionals and experts around the world. But like a lot of our peers, our company released guidance and white papers last week, actually, called, the Plan to Reopen the World's Workplaces. And while it was really well received by clients and a great document, naturally, a lot of the clients were coming back, and a lot of their professionals within my company were coming back and saying, this is great, but what are you doing with our offices and our CBRE 500 offices around the world, and what's your plan? So to answer that question, any minute now, we are releasing to our 100,000 professionals around the world the details around our return to work plan. It's a playbook. It's an executive briefing, employee FAQs. We're launching an employee, intranet site that really informs our professionals not on just what they should be doing, like a lot of people are providing guidance on, but this is really detail on how we plan to bring our people back safely to our workplaces around the world. Just kind of thinking about, if my kids were coming to visit me or future come to work in this facility, how would I want it to be operated? And that is going to drive change, and that's driving a lot of our behaviors and policies and decisions we're making around how we reopen our workplaces. And I think it's really going to make this community more valuable than ever.
Great, thank you, Peter. So how do you sort through all the information, all the new research that's coming at you? So when you think about what that playbook looks like.
So again, we're a real estate company, so I have the benefit of surrounding ourselves with some of the best experts in the industry. I have health and safety professionals, I have facility management professionals, I've got legal all at my fingertips. So we've assembled a cross-functional task force that's been working around the clock, like a lot of the people on this call and people sitting here on the panel, on trying to prepare how do we do this for ourselves. And you're right, there's a lot of guidance and a lot of facts to cipher through, but at the end of the day, we're the only ones equipped to really figure out how's best for us. There's a lot of people advising around temperature screenings or masks. When do you return to work? All those sort of decision points are really, really challenging and complex. But we just do it the best we can, which is surrounding ourselves with like-minded experts, both internally to the company. We've also engaged health experts, a partnership with a health institution and education institution to help advise us and advise our clients on how to return back to work.
Great, thank you, Peter. So David, same challenges. Your perspective is a little different. You got a portfolio with some of the more strategic occupiers in the country. What are you doing at JBG Smith to partner with those groups in your multi-tenanted spaces?
Yeah, thanks, John. And it's a pleasure to be with you and with Peter and Drew and hopefully Brian. And for JBG Smith, obviously is a major landlord in Washington D.C. For us, it is about responding to the needs of our customers, which is the end user occupant. So that really is at the core of everything we do. And so again, really grateful for this conversation this afternoon. I would start off by just noting, I thought the title of this conversation, Preparing for the Return, what is corporate real estate doing to, quote unquote, get back to work? And, while the title, I think, intuitively makes sense to all of us while joining via video conference from our homes here, I do just want to note that at JBG Smith, every single one of our commercial office buildings has been open and operational every day throughout this health crisis, which we think really is a testament to our on-site team, the engineers, the cleaning staff, the parking attendants that are making it happen to keep our buildings accessible for those needing to get into the building during this time. And also just, before answering your question and related, what has really informed a lot of our decision-making is the fact that in addition to being a major office landlord, we happen to own and operate and manage several thousand multifamily units in Washington, D.C. And so while our office buildings have been lightly occupied the last 6 to 7 weeks, our apartment buildings have been the exact opposite, with near 100% occupancy 24 hours a day, 7 days a week. And while that has created some unforeseen challenges for us on the multifamily side, it's also provided some tremendous lessons learned that we're now considering as we implement best practices going forward. To answer your question, it really is, for us, it is about the partnership that we have with the end user. Clearly, our objective is to establish a plan that clearly aligns with our customer. It is challenging, given the fact that we have a large and diverse multi-tenant portfolio consisting of hundreds of tenants. And so we also recognize that there is a point of delineation where there are certain best practices that are that need to be part of the landlord responsibility, but we also understand that at a certain point we need to provide flexibility for each of our tenants to really determine for themselves the best practices that they want to implement with their plan. Related though, what we've done is we've started with some guiding principles that are tied to what we call our healthy workplace blueprint. We don't use back to work plan for the reasons I mentioned earlier. We call it our healthy workplace blueprint. And so we've started with some guiding principles. First and foremost, the safety and health of our customers and our employees is our primary goal. So we're going to use that. We're going to keep that front and center in every decision as our guidepost. And so related to that, we're looking at the guidelines established by the CDC, federal, state, and local authorities for safe operation to drive all of our decisions. Really, the second thing is that from our guiding principle standpoint, we think government support, I'm sure we may talk further about this, but we actually think government support is really important for all of us to be successful, especially in the DC region where we have 3 different jurisdictions. We think that some consistency and clarity in message around that is really important. We're vocal about that with our elected officials, and we'll continue to do so. Good example we think is we happen to think it would be good practice for our tenants to wear masks in our common areas. But we feel like that is something that, while it can be a recommendation that we provide as landlord, that we really need the support of government, to reinforce that from a public messaging standpoint. Another thing that we're focused on is public transit, and making sure that government is taking a leading role in that. And then final guiding principle I'll just mention is that there are a number of operational items that we're focused on within our portfolio: procurement of PPE, personal protective equipment, social distancing measures in our lobbies, et cetera, which I'm sure we'll get into. But last is that communication with our tenant. As you referenced, we can have all of the guiding principles we want. We can have a great plan, from an operational perspective at the asset level. But at the end of the day, if we don't communicate it properly with our tenants, and if we haven't solicited their feedback to make sure that it's consistent with their goals and objectives, then it's not going to be as successful as we want it to be. So, with that, I'm spending, I would say, the majority of my time right now on the phone with our major tenants, talking through our plans, both from a portfolio standpoint and at the asset level, to make sure that we are aligning those and that it is a partnership.
Great. Thank you, David. You mentioned those guiding principles, and a scenario like this where, there's so many different decisions you can make, so many different paths you can take, to be relying on, those kind of cornerstone principles to help you frame up the right path forward there. It's such an important practice at this time.
Thank you.
So Drew, you've got a unique set of challenges. We're talking about returning to work, and maybe you're sitting there thinking, wait, I thought we've been working this whole time. So you've got your team that's out in the field, and the protocols you have in place for a job site, I'm sure, are a lot different from what we're talking about in offices. How have you been able to manage that at HIT, and what are those differences?
Yeah, thanks, John. Yeah, we had a team organized late February, early March. I think like most, as you're starting to hear the news come on, trying to get some awareness, at least at a leadership level, to say, okay, you really can't anticipate. We couldn't anticipate what it would look like, but we thought we were, right? And then, for us, it was March 12th. 5 o'clock, I got the first call, the very first person that had tested positive. And, I kind of joke, it's like you kind of get punched in the face at that point, and everything you've laid out, while it's good in practice, sort of has to really start to stand the test of the actuals that are going on. And that night, I think we were convened on a phone call till 11 or 12 at night, trying to understand, do we shut the offices down? What do we do with our job sites? And collectively, we took a large pause for the day, Friday, and we closed our offices, which is, I think the first time in forever where we've had an extended close of any office. And we went through the weekend, tried to decide, and a lot of the leadership, there's about 5 of us that came to our R&D facility, our CoLab facility, where we have, restricted access and a lot of space to kind of spread ourselves out and start figuring out what we did. So, we started, quickly putting together additional protocols. The job itself, it still goes on. And for us, it's our frontline workers for us are our superintendents in the field. And, they don't have the luxury of working from home. There's no work from home scenario related to a superintendent or any of the workers in the field. So, how does that happen? And we added additional resources, one for every job. And like I said, it's like 300 projects, I think, over time. And we started a new position. We just made it a site marshal, and we quickly came up with the screening questions and, all the protocols for cleaning, the signage, the elevator work, the staging, and pulled this together. We did 2 town halls the next week to try to get the information out. We did some training and quickly deployed this across all of our projects. And, our workforce is unique, and they're forward thinkers. But sometimes adoption is a little slow. For this, it was 100% adoption out of the gate. There was no real, no discussions, no, pushback on what it was or how to do it. There's a lot of questions on how to refine it as we went. So that was a continual process, and still is a continued process. And we started making our own sanitizer at this point, shipping it out across the country. I mean, I think our warehouse staff made upwards of 200 gallons of sanitizer that we distributed to our projects. Because if you think about it, in March, sanitizer wasn't available. You didn't know what was or wasn't available. We had a large, we have a client who has professional sports, and they quickly saw that they weren't going to use some of the things they had. So we cut a partnership with them to go there and take some of the supplies that they wouldn't use. They donated them to us and to the hospitals. We delivered that. So really kind of that was within the first week or so of going. And, no matter how prepared the jobs are, and our mantra out of the gate was going to be, let's make our jobs the safest. Money was really not in the equation. Cost, time, which is really hard to turn the corner from our superintendents and say, okay, don't be the most productive if you can't do it safely. Like they don't, it's very hard to rationalize that, but that was the number one say. I don't care what we do from a time and cost standpoint at this point in where we are is as it relates to being safe. So safety was kind of the first and foremost. But having gone through this now for probably 6-7 weeks, and having a number of cases pop up. And Dave was clear. We have probably 2/3 of our jobs are in a building somewhere, whether it's a tenant space in an occupied building that tenants still use the building, or the building staff is still in there, or it's multifamily. And then about 1/3 of them are on project sites where it's sort of insulated just to our workers. And no matter which one it is when the first case comes across and that information goes out, no matter how prepared you are, the anxiety that happens for the individuals related to either in the building or on the site just takes hold of the pressure. And so we quickly aligned ourselves with, protocol for shutting jobs down. Myself and my head of HR worked distinctly on every single case that's come out. We did all of our tracing. We've engaged our subcontractors at the ownership level. We've engaged, Dave's peer at JBG and some of the others on a daily call. We've talked to our own peers of other construction companies, shared a lot of information, posted it, and really tried to be, forward leaning on what it was going to be. And then as we sort of over time develop trends, there's certain workforces that seem to be having cases pop up more than other workforces on the same job or as a trend across. One of which was our electrical trade, and it's about the nature of their work. And so we convened a panel of the 6 or 7 of the largest electrical contractor owners, myself, and then Jeremy Barton, who's my other co-president, and then the owners of 6 or 7 of the largest construction firms, to understand why. This was about 3 or 4 weeks ago. Why do you guys feel like you're catching, the infections are coming up a little bit higher in your group versus others? And it really came down to how they need to do work. So we quickly implemented plans around what that meant, talked to our peers on some of the other construction companies that are doing, seeing the same things, setting up buddy systems, and it's touching tools and equipment. And no matter what level of cleaning protocol you go through, there's still an interaction at some level somewhere. And so really spending the time to dive into each and every one of those details, I think has really worked to help calm the anxiety across the workforce. And what it's done is it's propelled us into figuring out what our coming back into an office environment is going to look like. And so a lot of these same aspects are going to carry through as our offices start to reopen. And, we did a lot of staging of manpower on projects. We would split the projects up into an A team and a B team, and do 2 shifts and thin the workforce out so that you're not having density issues with workers. We're looking at that very same aspect as we start to look at our office, going through the screening, doing the site marshal, which is responsible for making sure cleaning's happening 5-6 times a day on all the high touch surfaces, all the bathrooms, the sanitizer. We look at our offices in the same way. There's elevators, there's stairwells, there's copiers. And so we've outlined the same things and implemented, a plan to have an office marshal in the same respect to do that same thing. Their job is to make sure it's happening. They're not actually the cleaners. Their job is to make sure it happens, and it happens on a consistent basis. So taking each of those lessons that we've learned and moving them ahead seem to be important. And then we've published a lot of this on our own, hit page for, quite frankly, anybody that wants to take it and use it, because it can apply to, subs, other contractors, or office environment. And, the next level, that's going to be the HR. And our HR team is up countless hours a day in the evening, 10, 11, 12 o'clock at night. For some reason, it seems like any test results come in at 6 or 7 at night, and then you sort of have to react, right? Do you close a job? Do you clean it? Do you start it back up? So those tracing, guidelines have been instrumental in us kind of moving the needle on our job sites. We've transferred that into some protocols that we're posting as well, so that, when you're in an office and you get your first confirmed positive in an office environment, all the coworkers go, whoa, what does that mean? You're a little bit more ahead on being able to react and talk through it and do the proper tracing.
Yeah, I was actually on your site the other day and noticed some of those protocols you're talking about, and it's interesting. You can see the parallels, between temperature screening and now you've got supply chain management and how to stay ahead on that, and to talk about the phasing of the A team versus the B team and all that stuff. I'm sure those are some of the things that we're all talking about in our own our own playbook for coming back to the office. Thank you, Drew. So Peter, you mentioned your playbook coming out for your occupier services group. You mentioned there might be some differences there between how that reads versus what you guys are actually doing for your own offices. Can you talk about that a little bit?
Yeah, well, first clarification, John. I mean, we're not going to be different from what we're advising our clients to do, but the distinction, the difference is that the guidance that we've been putting out there and helping our clients tackle the same issues I'm trying to tackle for myself and my organization is really, there's a lot of what to think about, what to consider. For me and then the task force that I'm a part of, it's been a lot about how do we really make this a reality and safely return to work. So just to provide a little bit of specifics around, our playbook or some of the things that have kind of come up or that we're going to try out. I mean, this is not going to be perfect and the playbook will evolve and things will change. And I think everyone can probably empathize with that. For example, well, I'll start here. I mean, we're going to be doing a staggered reentry period. None of our offices are going to be opening anytime soon, but we have to have a plan in place. There's a lot of, state, local, federal, just community pressure to reopen, and we need to be really thoughtful and deliberate about the decisions for when we decide to pull the trigger, when we approve and say, yes, that office, you're all cleared to open. And so for that, we've adopted a data-driven dashboard that has a whole series of criteria based on a lot of community readiness factors. Of course, the trajectory of caseloads and availability of supplies, a lot of different kind of community external factors. But then we also have in there, how prepared is that facility and building for reopening? Do we have the right number of supplies? How ready are our employees for going back? Do we have all the things that we need to do to get that office prepared for reentry? Have those things been taken care of? So, of course, a lot of the discussions around creating social distancing in the workplace, we have a tactical checklist and guidance for our on the ground level operations and field technicians and concierges, detailed checklists of all the things they need to do the week before that office is scheduled to reopen. For example, actually today, David will be getting a survey from me as one of our landlords of probably, one of our most important offices because, it's a JBG building. I sit there, but we're sending out a landlord survey. And we've been open, by the way, for like a total of 12 days before we were sent home, but it's great space. Check it out sometime. Any event, we'll be sending out a checklist and a survey to all of our landlords just to understand, here's CBRE's new enhanced cleaning standards and requirements. How prepared are you, landlord, to adopt that and adhere to it? What are the supply readiness that you have on site? What are the different social behaviors that are going to be changes? And just so that we can communicate to our people what it will feel like when they walk through the doors of 1900 N Street again. What's going to look like? And we need to send that out now so that we have a right amount of supplies. If JBG, in the unlikely event they drop the ball and don't have the supplies, we can go lean on our 6 billion square feet under management and leverage our supply chain partners to make sure that us as a tenant, we're well prepared. There's a lot of discussion on, the temperature screening, yes and no, and it's a very touchy subject. But, on the health guidance that our advisor is telling us, we are leaning towards really adopting an employee self-check approach. So we're going to have a whole series of protocols, and it's been screened by legal and all the right parties, where we've developed an app where employees can self-check and do their self-check screening before they go into the workplace that day. It's also in a tracing tool as well. I think, again, there's a lot of, this can be just a lot of scary stuff, and there's very anxiety provoking. So we as a company, we're also looking at how we can really rally the troops and make this kind of inspirational of we're all in this together all around the world. And so we're working with our marketing counterparts to create, toolkits for signage all over the office, but also an external facing branding campaign around, look, here is live tracking tool on the status of our offices reopening. So as virtually 80% of our offices are red at the moment. Over time, we'll start seeing the green dots all across the world map. And I think there's something powerful to that and something inspiring where we're being really transparent with our 100,000 professionals, but it also gives us something to be excited about and, kind of use that as a more inspirational market facing tool set. I mentioned again, we're really passionate about having, the employee FAQs and marketing videos and all of that on our intranet site, because I don't think, every professional is not on the front lines like a lot of the people on this call or this panel are dealing with. So there's just a lot of, I think someone's working on it, but are they? What are they going to do to keep me safe? And so we need to do a really good job of taking the lead, working with our communications and marketing counterparts to get the message out and really show that we have a plan. We're deliberately thinking about it, and it's constantly evolving.
John, if it's
So
okay.
Dave, he gave you a heads up it's coming.
Great. Yeah, it's Peter and I have talked about this, so it's maybe not a surprise that we're thinking about the same things, but it is striking that as we talk to at least our major tenants. Fortunately, I think we're all thinking about largely the same things. We just may be coming at it from a slightly different angle. So, Peter referenced personal protective equipment. I referenced it earlier. I think Drew referenced it as well. And, our approach on that is that we want to have enough supplies to get us through the end of the year. That's sort of our approach right now at a minimum. Is what we're solving for. So masks, gloves, cleaning suits, etc. And then, of course, once those materials come in, confirming that the quality of the materials are consistent with our expectations. The other thing is Peter mentioned social distancing. And, while, Peter and Drew and others on the phone are likely thinking about it within their space, the confines of their space, we're thinking about the exact same thing in our building common areas. So we have spent a lot of time and effort looking at the flow and the circulation of our lobbies to make sure that we're really minimizing contact for those arriving and departing. So we've got a heavy focus on great signage, stanchions that clearly designate one-way traffic kind of flow through our lobbies to make sure that we're, again, minimizing contact. And of course, every lobby in our portfolio, though, is different. Just like in Peter's, every space in Peter's facilities around the world are a little different. So we're also going building by building, lobby by lobby, and laying out a plan for each of those, which is helpful to us because we need that in order to procure the right number of signs and stanchions and supplies. But it's also a tool that we will roll out to our tenants so that, to Peter's question, when he says, Dave, what should I tell my tenant? What should I tell my employees on what to expect when they return to 1900N? We're putting together a package that outlines all of the changes we've made. And in that package, one of those things is a floor plan of our lobby, which shows that flow. And so when the CBRE professionals in Washington, D.C. want to return to 1900N, they receive that package in advance and say, okay, I get it. I know what's coming. I know what to expect. In addition to an electronic package, Peter referenced a video. We're doing that as well. We're pushing that ahead. There's a little bit of a lead time on that, but we're pushing ahead an informational video for our tenants. So we're thinking about a lot of the same things, which is helpful. And the last thing, just want to mention is Drew had touched on information sharing. And I think this call is a great example of that. But it really has been, I think, quite refreshing to see how, whether it's in the contract, the general contracting community or the landlord community or the end user occupier community, there's a sense that we're all in this in terms of sharing best practices, and I think that's incredibly helpful during this time.
Yeah, it's a good point, and it's hard to picture what the world's going to look like in months or, post coronavirus, whenever that day comes. But, you wonder about the lessons learned now that are here to stay. And maybe there's some things that, again, hard to think about now that are changes for the better. Drew, you mentioned that you guys have some different protocols on your job sites. Are there things that you've learned through this that you think are, here to stay, and this is the program we'll probably put in place for, the foreseeable future, however long out that is?
Yeah, I think there's the immediate, which is probably now to 12 months, or until there's something concrete that can calm the coronavirus fear and is real, right? So that for the immediate, we don't see changing any of our protocols through the summer, and then hyper awareness if things slow in the summer, hyper awareness going into the fall and the winter, obviously. So those don't change. But I mean, for us, anybody that's going to come into our office or job site has to have a mask on. Any worker on job sites is 100% wearing masks. How that translates, through post-COVID is interesting. I think, it's definitely helping clean and sanitize locations. Up in the cleaning and sanitizing, in all reality, while it's a hit to the overall bottom line, it's not monumental. It's easy, right? So why couldn't that carry forward, post-COVID? There isn't really a reason why it won't. In our offices, if you're sitting in your office or in your cube, the thought's going to be, you don't need to wear your mask until you get up and circulate the building. Now, our office is, 11 years old now, 12 years old. And our workstations are still, I think, 8 or 9 feet apart. I think they're still the old guard. So it'll be unique to see what the floor plans of the future look like. But, in addition to that, the health screening questions, the 4 questions, 5 questions, it kind of changes as we go. That's going to happen at our office, whether you're a vendor or even a worker, team member coming in, or on a job site, whether you're a construction worker or not, that comes every day. The temperature screening is interesting for us. We see a lot of information on it. The thermal cameras of late hadn't gotten down to the right piece, for the right value. You can't get to a small enough range. I think there's a few out now that have actually conquered that. Still not a small price, but what we found in all the cases, and we have a lot of really good data. There's a number of cases to track the data, that the temperature part has been such a lagging indicator of people that have either tested positive or started to feel symptoms to then go test positive. It's been such a lagging indicator, or it all comes on so quickly. The temperature screening was sort of one of those things we were trying to figure out the best practice. Now, there's a number of jobs where we use it, and we do it with a third-party system. But trying to, those lessons learned of even inside the new protocols, which work and which don't, I think are going to hang on for a long time, for sure. There's the signage and those other things are easy. How you enter into a building, with stairwells, the traffic flow. David, like you were talking about, we're talking about it, at our headquarter building. We own the building, so there's not a multi-tenant space, and we can clean it and address it. But in the rest of the offices around the country, landlords typically are night cleaning. How do we keep up the high touch surface cleaning, the handrails, the elevators? We're bringing in our own cleaning services, or working out with our landlord how to have those cleaning services happen, continually. And I think those are practices that probably won't go away for a very long time.
Yeah.
If I can follow into that real quick, Drew brought up some really good points. I mean, in this, it's almost like the pre-vaccine period and the post-vaccine period, whenever that takes place. So, Drew, you mentioned kind of from now, the next 12 months or so, and then afterwards, what are the long-term implications? But I think for the immediate near term, you're right, Drew. We're going to see a lot of stepped-up cleaning. For us, we're stepping up our day porter scope and level of service. So we really want our employees to see, smell, just know that things are being cleaned throughout the day, and that it's not just, as you said, the invisible shift, that it's a night worker crew that's cleaning the building. We really want our people to see that this is stepped up throughout the whole day. So that's going to be like 4 to 5 times throughout the day that they're running through with that enhanced cleaning. And I think there's almost a knee-jerk reaction that could take place around what can we do to just change workplace design now in response to COVID versus also what will be some long-term implications. So I think coming out of this in the short term, we're going to see some like really great leading organizations that create inspiring workplaces, but they will also be leading with innovation. We're going to see some great new technologies, I think, come out of this that will make experience at work easier and safer. We're going to see better access, HVAC space utilization technologies so that we can just monitor that we're operating in a safe environment. That is one area, and particularly the space utilization technology that we're investing in to deploy across all of our offices so that we can see who is really coming back to work. A lot of our jobs can be done at work. Now, in my role, because I oversee corporate real estate, I want people to come to the office and feel safe they can. I like to think that we create a little bit of a FOMO factor with our workplace, that you're missing out if you're not collaborating and meeting with your peers. So we want to try to figure out how we can facilitate that by de-densifying the workplace, reducing conference room capacities, maybe in the near term, all of those kind of social distancing change behaviors and reconfigurations that we're going to do now. But even just long term, I've got to say that we are going to see a lot of just touch-free everything. I mean, does anyone remember when we used to go to a gas station, they'd have like the reusable paper towel thing? Like, how disgusting was that? So I think we're going to have like a much more critical perspective on all the things that we interact with on a daily basis. And we're going to be keeping the folks at HIT and all of our other, partners busy with changing out the components to make things as touch-free as possible on access and restrooms, the faucets and the break rooms. Like, there's going to be probably a way to get your coffee spit out in a touch-free manner. That's something we're grappling with right now. So I think that is going to be a long-term sustainable trend we'll see.
Completely agree with Peter on that last point, and it is. I think you're absolutely right, Peter. That in some ways necessity is the mother of invention, and we're all the last 6-7 weeks have forced us all to reconsider and look at so many things within our respective portfolios and lines of work. And I happen to agree. I think you think about touchless, hands-free components, and I think there's some low tech things out there that will probably be very early in our process and others, but we're also looking at it on a longer term basis from a technology standpoint. And I'm sure a number of us know that there's various technologies, apps, et cetera, out there that can be tied to access to your building. And I think that this will likely advance a lot of those technologies over time as well.
Yeah. David, is it too early to pick up some of that stuff in new development you have in the pipeline, or are you already starting to see some changes, that around some of those common areas and touch free and all that other stuff?
Yeah, it's a great question, John, and JBG Smith, we own and operate a significant portfolio in DC, but we're also a developer, and so we are taking a very hard look at it as we look at the future of office building and design, and what these current trends mean, and looking at things such as multiple access points, sort of building within a building type of design to give a number of large tenants their own dedicated access, and then all the way through to the technology such as hands-free technology, and then of course the building systems themselves, air filtration. I'm sure a lot of us have read and are reading about some of these latest ultraviolet light technologies that might improve air filtration. So we're studying all these things real time. We have some sites that are some of our office building sites where we're taking a close look at our development plans to see what changes we might make in light of this experience. And I'm sure, Drew, I know you're hearing from us, and I'm sure others, that are actively, looking at all of these things. So curious to your perspective as well.
Yeah, it's interesting. Those small nuances have already started to pick up. We've gotten a lot of requests for, whether it's sensor operators on doors, restrooms. A lot of them may be set up to have touchless flushing techniques and faucets, but the soap isn't, right? And so how can we change those out? How do we get that done quickly? And then how do you reopen a door on the inside versus the outside automatically? So we're, the one small benefit for us from everybody teleworking is that buildings are open a whole lot more for us to get in and do work really quick, get out, small projects like that. Even multi-phase projects that, had a longer tail on them. I think clients have jumped on the opportunity to, shrink the overall duration and catch some savings because people are naturally working from home. So there's more available square footage to work in and have your proper distancing. And in our conference rooms, we're taking seats out. And I think a lot of our clients that we talk to are, trying to figure out if their use of conferencing space is an important part of their business. Those quantities of rooms are driving the count of available employees who are able to come back. How many? Because if you can't book the amount of conference space that you need in order to do your work, it's become an issue. So many clients right now are quickly looking at how do I take a wall out between a couple offices and create some more conferencing space, quick hitting projects that you can do under maintenance provisions and get done. And it allows some more flexibility, if not anything more, just peace of mind, but also in practice. So, even for us, we set up a bid room, which normally would have people sitting next to each other, bidding large projects. It could be 10 or 15 people in a room. Luckily we have a couple spaces that are really large. So we've kind of moved that whole program into a much larger space, set it up. Same thing for interviews as projects, come up and we need to interview or present for a project. Those are all virtual now. And what platform that is and how the cameras work, even this, that it's becoming a whole lot more aware. And so we're already forward leaning on doing that both in our office and for our clients.
Great, thank you, Drew. So we've had some questions poured in here from the outside. So wanted to get to some of these here. So just holler if you want to provide some feedback on some of these, but I'll just get to these questions out in the poll here. So social distancing, I'm sure that's got to make it into everybody's plans in some form or another. What does that look like for each of you?
Well, I'll start first. I mean, for us, it's really planning on who needs to come back in and when. And like I said, we're being very deliberate about our reentry and trying to achieve a target occupancy load of about 20 to 40% in the initial weeks of reentry. So that inherently creates some space and de-densification. Other things is we have in our Workplace 360 program, where it's totally free address. We have a lot of 40% of the office is workstation, 60% is enclosed. So how do you create that social distancing in kind of the sit-stand workstation environments? We're going to be kind of doing a, shutting down every other desk in kind of a zipper fashion so that you create at least a 7-foot distance between the people. But we don't want to go to assigned spaces, and that's pretty controversial. I think the immediate knee-jerk reaction of some of our executives would just go back to assigned spaces. We studied that, talked to a lot of experts, and it was, that would just create clusters. We still want our employees to have choice. And if I'm sitting 7 feet away from David Ritchie and he comes in with some bad allergies that day, I'm like, you know what? I think I'm going to pick up and move somewhere else. No offense, David, but I don't know what you got going on. And so I think giving our employees that aspect of choice is still really, really important. And so we'll have, different tape and different stickers on the ground, creating kind of social distancing around common areas. And there's some arrows. And so we're just trying to do the best we can and kind of come up with how we can plan for it now. But we'll learn a lot in the first 30 days once we start to reopen these offices.
Yeah, I think what we've learned real quick, just to kind of hit it real fast, is that having a specific set of eyes to kind of remind people about social distancing. You would think it's sort of second nature, but I can tell you it's not. There's plenty that are paying attention to it, and there's others that'll come in and try to give you an elbow five instead of a high five. Like, that doesn't really keep you 6 feet away no matter what. And it's just natural in some respects, because you're kind of coming out of your house or your environment. But having that extra set of eyes, that's just sort of reminding people, hey, you guys are waiting for you to use the copier. Don't be standing there, 3 or 4 people on top of each other. Make sure you're spreading yourselves out, and et cetera.
Got it.
And I'm just going to say, I think, I mentioned earlier that, we've thought long and hard about our lobbies and the arrival and departure of our buildings and how that relates to social distancing. I'll just add to that, of course, it also translates into our parking areas, recognizing that a lot of our tenants at the end of the day come and go by car. And so bringing it down into the parking areas, those same things, signage, path of travel, et cetera. And then also, Peter and Drew touched on his elevators. And so we've been working with a consultant looking at all of our elevators across the portfolio, determining maximum capacity in the elevator. We've now, we've ordered the stickers so that people know exactly where to stand in the elevators. We'll be installing those in the next couple of weeks. So, it's kind of, it flows throughout the common areas for us as landlord.
Yeah, I guess you get down to those choke points. There's only so many elevators, only so many ways in and out. So it's, to some extent, it seems like there's got to be a modified form of, what's the acceptable social distance, within the actual office. One of the questions that came in, and just throw your hand up if you want to grab it. What are the requirements of vendors coming into the facilities, and how is that different from what you're asking of your actual associates or tenants, as the case may be for you, David?
Yeah, I'll take that one, John. I'm glad that question was raised, because that's exactly how we're thinking about it from a symptom testing standpoint. So we're still, I mentioned, having a lot of conversation with our tenants right now. So we have not made a firm decision on this, but by and large, where we're heading is, or at least we think we're heading, subject to some more feedback from our tenants, is that we are not going to have symptom testing for our tenants. We'll leave that to the tenant, Peter and others to do for themselves, for their organizations, but that we will have very stringent standards for our employees and vendors entering the building. We feel like that should be on the landlord, and so we are establishing a process around that. That'll involve, I would say, at a minimum, a questionnaire. Drew and others, we've seen a lot of the contractors have established a questionnaire that is required to be completed by anybody entering the building. But we're also taking a hard look at the different temperature screening options out there. Drew mentioned earlier some of the thermal imaging technologies. We're studying those, and if we feel like we can find one that gives us a level of confidence in its accuracy, we're taking a really hard look at that. So high level, no symptom screening for our tenants. We'll leave that to the tenant to do for themselves, but a very stringent process for our employees and our vendors.
So Drew, this one came in. Yeah, go ahead.
No, go ahead and ask your question, and I'll just add it on to whenever you're at.
Sure. So this one came in for you. We touched on the HVAC stuff and UV briefly and all that stuff, but has your group been studying any of the changes to HVAC systems with regards to filters, humidity, any other technology there?
Yeah, we did it sort of out of the gate for projects that have construction trailers, where we have more condensed location. The rest are really projects that are owned by somebody other than ourselves. But a lot of the UV, the filtering in place on a temporary level, we found some easy bolt-on components here locally. A lot of our healthcare clients, we have had team members working around the clock at the height of this, converting rooms from, just standard acute care to isolation rooms. And an isolation room is a negative pressure, facility. So literally working around the clock, at some of the major healthcare providers here locally to convert rooms over and over again. And what we found is like the more we can get that negative pressure situation and pull more units up, from a healthcare perspective, it's stronger, right? And so you can translate that into an operating building. And a lot of the buildings, especially the ones in the last 5 years or so, have specific equipment that can do this, much easier. So there's some real easy applications you can put that we're actually we're going through trying right now in our own headquarters as it relates to speeding up the drives and putting filters in place, and then getting some of the UV filters on top of that to help really give the best that you can to it. And we'll see how it turns out. We'll put that out on the information line as much as we can.
Thank you. Just throw your hand up if you want to grab this one. Do you think overall square footage of space will increase or decrease within the short term and as a long-term occupancy strategy?
So I'm back in now on my computer.
Peter, do you want me to?
Yeah, why don't you go first, David?
Sure. So this is one that we, as a landlord, are obviously spending a lot of time, thinking about, and it is, of course, it's a bit of a crystal ball.
You can send me a share.
For any of us, I'm hearing a little bit of background. Can you all hear me?
Yeah.
Okay. So it's one that we are spending a lot of time and thought in consideration. Obviously, there's two sides to the equation, right? On the one hand, social distancing, we believe will require companies to rethink densification. As we all know, there's been a huge trend towards increased density in office space over the last 10 years. We think it's going to, the tenants will reconsider that. Of course, we're well aware of the flip side, which is that while all of us miss the office, and there are certain elements to working within an office building that can't be replicated on a call like this, that companies have figured out ways to be efficient and to be somewhat productive in this period of time. So at the end of the day, we think there's sort of two counterbalancing forces. Of course, as landlords, we'll be optimists and hope that the higher densities, result in more demand. But realistically, we know that there's two sides to that equation. So I'm really curious to Peter's perspective from the tenant in terms of what he thinks will happen.
Well, it'll be real quick. I think you're right. There's a counterbalance. There's some people who will require greater density, more space, great for landlords. And then there will be some people who are like, hey, a lot of our employees are now working pretty great the last 2 months working from home. We'll need less space. So I think at the end of the day, I don't really know the answer to that because it could really go both ways. But I think it will, again, force us to be really critical around space utilization, which is why we're frankly rolling out a whole technology deployment just to study that exact.
And it seems like there's plenty of folks out there who are desperate to get back into the office. The home office, I think we're all learning, is not for everybody. And there's one right there. And I guess a big piece of that is mass transit and what impacts we see and when that gets back to normal. You got to think it will at some point, but that certainly changes how dense you can be. Right, especially around those urban settings.
I mentioned earlier. I was going to say to that point. John mentioned earlier that we think that it is important that our local elected officials provide some guidance on capacity of public transit in terms of what is realistic in terms of how much capacity can the region handle while, allowing for, some level of social distancing and, higher level of cleaning standards within our public transit. So, we're big advocates that our elected officials need to, establish some consensus around that and communicate that.
Just to kind of add to that point, John, we've had workers, coming to work, consistently now for weeks. And, I totally agree with David, what you were saying on really getting our elected officials to get there. Sort of some of the other side of that too that we're seeing is, it really comes down to some basics, right? You have to have a mask. You have to have some type of face covering, in our opinion, and that's how we've driven it. And you have to be diligent about washing your hands and not touching your face. And driving those processes seems so easy, but it's so unnatural for a lot of people. I think relatively, as they come out of their house where they feel like their bubble is, pretty sanitized, or at least it's their bubble, right? But now you come out and then you get out there and you're touching your face or touching your hard hat for our people, or, not washing your hands. That's what we've been driving, and plastered signs everywhere about make sure you wash your hands. We put hand washing stations everywhere. We put sanitizer everywhere. And I think, part of the trend has got to be, paying attention to those little things that are literally the number one, driver of how people can stay healthy, for sure.
Yeah, part of the strategies has to be those reminders, throughout the office, wash your hands, this is what 6 feet looks like, just always have it in front of people's face so that it's got to be top of mind. And to your point, Drew, it's the simple stuff, but you just gotta keep it in front of people. So real quick, gentlemen. So we asked the question to start, when folks are planning to reoccupy the office. So I was just going to share those results with you real quick, and just want to get some feedback, see what you guys think, and how that matches up with your expectations. So 30% said before mid-June. 56% said between July and September 2020, 9% between October and December 2020, 5% January 2021 or later. So the overwhelming majorities, between July and September, 86% basically saying that before September they intend to be in the office. My 2 cents. I'd have guessed a little bit of a wider spread there, to be honest with you. But I'd be interested to see what you guys think.
Yeah, I'll take that first. I think that, I think that's kind of in line. I mean, we're telling our team members, like, no one is going in before June 1st. That's not saying we are opening even a single office June 1st, but we're already getting some demand outside of this area to reopen sooner. There's been no cases. There's no. So they feel like they're ready, and the people are ready to do it. And I think for us locally, we'll probably in that more middle of the road, like a post-June timeframe. But I would love to scare David and say, we're coming in on Monday, be ready. But I won't.
David, what do you think of those numbers?
Yeah, I mean, I mentioned earlier, we've been clear about the fact that our buildings are accessible and have been operating this entire time. And Peter, you can show up there today, and it would be accessible and operable. But with that said, in terms of our time frame, in terms of preparing for an increase in occupancy, we're targeting June, early June, in terms of these, sort of the day one rollout of a number of the items that I mentioned earlier in terms of our lobbies, et cetera. So that's our time frame, is sort of a day one rollout in June. And then, as we mentioned, I mean, I think we're all going to be adding, adjusting, soliciting our tenants, and this will be something that we'll constantly improve on, going forward as well. But June is what we're targeting, and so I think that's to make sure that we're prepared, for that 30% that was referenced in your survey. But at the same time, recognizing that we don't expect to be at full occupancy in June, because we do anticipate that some organizations within our portfolio will come back later and staggered over time.
Drew, any reaction to those results?
Yeah, I mean, for us, this Friday we have a virtual town hall where we're going to kind of lay out, the overall plan to our team members. But we've had probably 5 or 10% of our workforce at our HQ for the entire time, on their own. While we're restricting it, you can't really restrict for a lot of the things we need to do, and while the fields are running out in the office. So, our plan is a phased, occupancy by density, and it has to do with different business units and how they interact with each other, but it's also having 2 teams. And so, I think somewhere around the end of the month, beginning of June, we're going to increase that 5 to 10 up, whether it's 30 or 40% plus or minus. And then, there's a few gates that we would pay attention to before we get to the next level. But by somewhere around the 1st of July would be great, but we're not rushing any of it at any point. We're just going to, start the process going and pay attention to it. But, the other factor that's in the background is giving people maximum flexibility right now, because, anybody with kids at home or family members at home or adults that they don't have school, they don't have daycare, you have to have some level of flexibility. And so we want to make sure we're listening to our team members and being able to give, the amount of flexibility we can to those folks. And as we start to hear more about it, what the real pinch points are, we're going to work hard to try to engineer out a solution so that we can help, everybody in being able to get through where we're at today.
I think flexibility is king. I couldn't agree with you anymore there, Drew. And I neglected to say at the outset here, Brian Dean, who is the head of real estate for T. Rowe Price, was on the docket to join us today, but because of technical issues, unfortunately wasn't able to get in. So nonetheless, I wanted to thank Brian for that effort. And looking at the clock, that was a fast hour, 15 minutes. So I really appreciate you guys carving out the time. Things couldn't be crazier for all of you in your respective worlds. And I know it's not easy to carve out the time for something like this, but it's been great. Appreciate all the insight, the candor, and a lot to think about here. And thank you, gentlemen, again. As a reminder for those that can make it, we're going to recap at 4:30 for a happy hour and sharing lessons learned here. But Peter, David, Drew, thank you guys sincerely for carving out the time and chatting with us today. It's been great.
Thank you, John.
It's been fun.
Drew. Good to be with you.
Thank you. Take care.
Great. Thank you.